So when we advise for a total knee replacement for our patients are usually worried on what is going to happen with them. Obviously, the replacement surgery is a surgical procedure in which the patient has to be admitted and has to be with us for a period of time. So to reduce the apprehension of the common population, we have a patient with us. His name is Mr. Jagdeep, and he is one of the senior officials in a government setup. And he has undergone a bilateral total knee replacement with us. So here he is fortunate and he is ready to share his experience with what he faced when he underwent total knee replacement. I welcome you, sir. So just a brief introduction about you, and then I'll ask you a couple of questions so that you can answer it and we can reduce the apprehension of the general population.
Hi, I am Jagdeep Singh. I'm in the government service, and I was suffering from this knee pain for the last few years, 3, 4, 5 years, and it got worse and worse and worse. Then I heard of Dr. Apurva Mehra. I came to him. His nature and his advice. Then I went in for the surgery.
Okay. So you were told that you have to undergo a total knee replacement for your arthritis of the knee. So how was your experience in the hospital? So what happened? How did you get admitted in the hospital? Was there anybody to support you, or you had to go alone and get your stuff done?
The whole team of Dr. Apurva was there. They helped me get admitted. Then throughout my stay, they were there always with me and checking on me, and which made my hospital stay very easy. There was nothing that I needed to do. Whenever I wanted anything from the hospital to be done, there was always one of the team members there who would be ready to do that for me, whether it was the medicines or the billing or the admission, anything. The whole team was there to help me, which made the whole procedure very easy for me.
Okay. So on the day of admission, what happened with you, sir? In the initial day itself, did you undergo the surgery, or were there some procedures?
No. The first day when I joined, when I was admitted in the hospital, I had to undergo a few tests, like cardio and blood test, etc., etc. And the surgery was on the next day.
Okay. So all these tests are done on the patient so that we as doctors understand the risk profile of the patient. So as Mr. Jagdeep Singh told that he underwent some cardiac test. So from that we understand that how much anesthesia we should be delivering to the patient and what kind of anesthesia we should be giving to the patient. So that is why all these tests are done one day prior to the surgery so that we understand, we in combination with the anesthetist understand what we have to deliver for the patient. So this patient had to undergo surgery on both the knees. So we had to assess whether his body was ready to accept that amount of surgery on the day prior to the surgery. So that means on that day, all the tests were done, you were fit for the surgery, and next day we had planned for the surgery. So how was your experience in the OT, like from shifting from the room to the operation theater, the anesthetist?
I had no problems. The whole team was always there to help me out. And from the room to the OT, then from the anesthesia, actually, I didn't feel anything. It was so smoothly done, that apprehension that one has. One should not have any apprehensions on this. It's a very smooth process. And when the whole team is around you, they give you that courage so that all your apprehensions are over.
Okay, so the surgery was done on him, and after that, where were you placed after the surgery?
During the surgery also, everything was there. Doctor was talking to me, encouraging me, because I had this local anesthesia. It's not the whole anesthesia. After the surgery, I was shifted to the post-operative room, where I was kept under observation for some time. And then I was shifted to the ICU, the surgical ICU, where I was kept overnight.
Okay.
And then the next day, I was shifted into the room.
Okay. So this surgical ICU that we have is not the ICU that you hear about. It's a post-operative ward in which we can give separate attention for our post-surgical patients. So the patients who come there are the patients who undergo surgery and come there. It's not like a COVID patient is admitted to that same room. It's not like that. That we have a separate ICU in total. So these patients are the knee replacement patients that come to that room. The entire set of patients are just post-operative care patients. So that's what happened. And then the next day, he is shifted to the room. And when did you stand up, sir? When were you made to stand up?
Once I was shifted to the room, no, in the even the post-operative, the surgical ICU, my physiotherapist was there to help me do some exercises. Then she told me, look, then once I shifted to the room, they said, we'll now make you stand. So next morning, the physiotherapy was there back with me, and then I was made to stand immediately and may take a few steps. And then they went through all the procedure of how I used to use the washroom myself without any help. And then day by day, my steps, walking steps increased. And they were helped by the physiotherapist.
So day one itself, we had started physiotherapy for him. We had made him to stand. We had given him toilet training, and like baby steps, we started making him walk. And he was quite confident before the discharge to walk with the walker to the washroom and even in the corridor. One more major concern that the patients have is the post-operative pain that they experience. So how was your experience?
No, my experience is, look, since it's a surgery, obviously there will be some pain. But one thing this good about this is this pain is not going to last. Ultimately, it is going to come down day by day, day by day. It is going to reduce. The pain you had with the arthritis was going to improve, was going to increase every day, and make your life very hell. But this pain, obviously, it's a surgery, mind you. It's one of the major surgeries, so there will be some pain. I don't say there's no pain, but that pain is controlled by the doctors through the medicines. And by day, as week by week, the pain keeps coming down. So that is the major factor of this surgery, is that the pain will come down. Ultimately, you will have a painless life. That is what I am now experiencing. After about 1 month, I am walking with the stick. I am going around here and there, and I have no problems. Otherwise, before the surgery, it was a tremendous task just walking a few steps.
Okay. So at around day 6 or 7, you were discharged from the hospital. So was it a goodbye to Dr. Apoor Mehra and his team, or were they calling you and following it up, or how was it? How was the experience post-discharge?
Post-discharge, there is no goodbye. Yeah, the whole team is there to help you out with everything. Whatever queries I had, I just have to give in a message, and immediately there was a reply. So whether I have to take this medicines, or some medicines were giving me a nausea, then they changed the medicine. Then there was this dressing to be done, which was done at home by the doctor's team. And again, when this staples were supposed to come out, all done at home by the doctor, and they were regularly inquiring about my health.
So now, how many days post surgery, sir?
It's about 1 month and 3-4 days.
Wonderful. And you're walking comfortably?
Yeah, I'm walking comfortably. Good. And today I met the doctor, and he's very positive about my improvement. And okay. I'm also very impressed, and hope to be walking without the stick in another few days.
Sure. Thank you. Thank you, Singh sir, for your honest opinion about us. And we are very happy that you have given such honest reviews and experiences that you had faced. Thanks a lot. But one thing which we noticed in Jagdeep Singh is that the confidence that he had and the willpower to walk. That was the main thing that helped him and us doctors to give him the best results. So just a few words about that to the general population.
I just say, look, it's the confidence within you. I am walking every day. Every day, say from the day I was discharged, and I have been increasing my steps every day. Today, I think at home only, I am taking about 1,500 to 2,000 steps every day.
Wonderful.
I am walking in the house, and I have my set target that I have to take about 20 rounds, and one round is about 25 steps. So ultimately, there is no gain without pain. So little bit pain will be there, but that will improve within days. So I think everybody should, who has this problem, should have no apprehension of going in for the surgery.
Thanks a lot. Thanks a lot for your valuable time, sir.
Thank you.